Hi, in this video I'm going to be talking about what to expect after stopping aromatase inhibitors. I would love to invite you to subscribe to our channel. We are always putting out new content, often in response to your comments or questions. I would also love to invite you to go to yerbba.com to get your personalized Yerbba report. You might be wondering, are aromatase inhibitors part of my treatment plan? You might be wondering, are there alternatives to aromatase inhibitors? Your Yerbba report takes everything we know about you and your cancer from your medical records after you give us permission or upload your records, creates a report that shows everything we know about you, all the treatments and tests that you've had, and what you might expect going forward, what might be offered to you at doctor visits, and the pros and cons of each. It also gives you, and this is one of my favorite features, suggested questions to ask your medical team. Sometimes people want to know, what should I ask? And we give you questions to ask related to that specific part of your report. So you're about to stop aromatase inhibitors and you're wondering, what should I expect when I go off these medications? When will my side effects get better? I'm going to go through the ones that get better more quickly and then the ones that take longer. If I miss your specific favorite side effect, I would beg your forgiveness in advance. Just drop a comment or a question below after you've watched this entire video. All right, so what can you expect when you first stop? Well, some of the side effects that people have will go away really quickly. We're talking like within 4 half-lives of the medication. So that's less than a week or 1 to 2 weeks. Nausea, dizziness, stomach upset, headache, heartburn, chest tightness if you've had it, dry mouth, these things, dry eyes, will go away really quickly as your estrogen comes up and the drug is out of your system. So basically, if it's caused from the drug being in your system, the side effects will go away when the drug is out of your system. And generally that's in 1 to 2 weeks, so something to look forward to. Now, normally we would think that hot flashes might go away really quickly because they may have shown up really quickly. But hot flashes are peculiar. They're really idiosyncratic. In some people, they go away almost immediately, and in other people, they go away over 2 to 3 months, but then might come up under situations of stress. Your body may be kind of used to having hot flashes, and you may actually find that your body is conditioned and that you can trigger it with stress or with caffeine or with spicy food or with sleep problems. So hot flashes are a little different. We've heard from you in your comments that it can take a full year for you to feel as if you were never on these aromatase inhibitors. And there are some things that won't get better. So I want to cover those next. One of those is if you have trigger finger or problems with your hands, those may not get better if they're really severe. While some people may notice that they get better in 3 to 6 to 12 months, some people may actually require injections and those symptoms may never go away. Another really important one is your bone mineral density. Now, you've been on an aromatase inhibitor maybe for 5 years. Maybe if you had high-risk disease, you've been on them for 10 years. Over that 5 or 10 years, or even if you've been on shorter, time has passed. And one thing we know is that bone mineral density goes down over time. So if you're 10 years older than you were when you started an aromatase inhibitor, or 5 years older than you were when you started an aromatase inhibitor, your bones would naturally, even without the aromatase inhibitor, have lost some bone mineral density. So while stopping the drug will bring your estrogen back and your bone mineral density the decline may actually reverse, it may never go up to what it was at baseline because you're now 2 to 3 to 5 to 10 years older. I'm hoping that makes sense. If it doesn't, put a question below and we'll get back to you just as soon as we can, hoping to clarify that. Similarly, with your lipids, your cholesterol, and your heart problems, any heart problems you have, those will also get worse over time, with time, Even without an aromatase inhibitor, cholesterol gets worse over time. Blood pressure gets worse over time as our arteries stiffen. So even when you come off the aromatase inhibitor, with the passage of time, you may not see your cholesterol going back to what it was at baseline. You will see it improve, though, most likely if you've had high blood pressure or cholesterol problems, though it may not go back to what's considered normal. I'm hoping this is helpful. Mood problems tend to get better over time, but if other things have happened in your life, or if you're suffering from other things, or if depression runs in your family, or if you've had a history of depression, and because of breast cancer itself and the changes that its treatment brings, your mood may not go completely back to normal. But if it's attributable to the aromatase inhibitor, your mood should get better. Now, if you just have been on an aromatase inhibitor for a few weeks to months, all of this caution about your bone mineral density and your heart risk and your mood is not as relevant. It's if the passage of time has happened that you may not see things go back to normal. I have covered a lot in this video. Thanks for sticking with us. Drop a comment or a question below. And I want to thank you as always for watching. We'll see you next time.